We're going to talk about AP mobilization of the distal femur and the proximal tibia in supine. Okay, so kind of for the purposes of this and all of FMT for that matter, this is something that I got super hung up on with convex concave rules in the FMT courses. So you just have to kind of throw that out and just trust a hard infill. That's where hard infill is king in this approach overall. All right, so we want to assess AP of both of these structures from the front for the purposes of the extension, believe it or not, right? So we are in extension. I am biasing the foam roller underneath her femur, as well as underneath the distal portion of the leg, because that puts us in more extension relatively. If this is kind of like their full extension currently, you can do it like that. If they're just like really lacking extension, like maybe for someone who's had a TKA, but for most people, if they're lacking extension, it's that last, like, I don't know, 5, 6, 7 degrees or so. And like our knees most people's knees have some amount of hyperextension as well. So basically you just want to be able to have a springy infill. Now, if I'm going to assess this, I want to put her in relative neutral, and most people are going to be externally rotated. And so we want to put into neutral. And then I just want to stabilize the femur and feel if I put a vertical force directly over her tibia, sink in, and then spring, is there springiness there? Okay? And then I want to compare that to the proximal femur. Then the same thing, get it neutral, stabilize through the tibia, and then I want to put a force through the femur. And the femur has a harder infill than the tibia, so I would be interested in working on the femur. Okay? So in order to do that, I am going to take up that slack. I'm going to check three-dimensionally where that hardest infill is. It's actually kind of straight on. And then with this one, I can actually resist through plantar flexion. So go ahead and plantar flex there. Good, and let it go. I don't like that so much. Don't let me lift your heel up. Hold there. And that actually gives me a good infill. And let it go. I could also have her like dig her heel down into that foam roll, and that's great also. Then I could use both of my arms and let it go. Like I'm having to come. Always check your body mechanics. You want to be, basically, you really want to be able to get over the top of wherever you want your input to be. If the table's too high, your shoulder blades are going to have to go up, and then you're going to have to arm it. This way, if I can come over the top, I can actually sink in and now press your heel down into the table. And now I have more control, and it probably feels that way to her also. Okay, so that is AP assessment and mobilization of the distal femur versus the proximal tibia.